health and a little wealth and a lot of love.
Well, I know that you are certified in obesity medicine, so how does the polypharmacy in obesity medicine, like with weight gain or weight loss, or impact your overall health?
So, like you mentioned initially, the medications can all have potential side effects. So we talked about some of these antidepressants or anxiety medications, the antipsychotics, the ones that we use more for like mood stabilization or agitation or psychosis. And a major side effect of a lot of these medications is weight gain or metabolic syndrome. And so that's another reason that you really have to think, is this medication really necessary? And when we look at our list of medications that we use, really considering what are the side effects, which of these medications poses a higher risk of causing weight gain or metabolic syndrome. And sometimes, as people who have taken depression or anxiety medications in the past, a lot of times those first multiple medications that you try are ineffective, and you finally find one that really works well for you, and you have that potential side effect, but the alternative is, having major psychiatric issues that are life limiting, and your functional status is limited to the point where that medication is really helping you improve your life. And so you have to consider how to kind of offset those side effects and prevent a whole other realm of side effects that include, potentially increasing their blood pressure, increasing their weight, that will increase their risk of having diabetes or heart disease in the future. So you really have to think critically. And I think another problem with this system where you're seeing patients frequently, and sometimes you're seeing a patient, they're moving to a different doctor, they're moving out of state, and they come in with this list of medications, and that list of medications, you don't know if something was just started, if the person that started them on that medication before truly thought about what the potential risks, what the benefits were. Are you just going to continue those medications? I mean, you really have to do what we call a medication reconciliation when you get a new patient to really start from scratch and say, like, which of these medications are truly needed, which are potentially causing side effects,
A good doctor does that, though.
But that's the problem of our system right now, is that there's just not a lot of time.
Right.
With a little health and a little wealth and a lot of love. That's the life that we live. Susan Scruggs.